All right, we'll go ahead and get started. We will, I know we haven't taken our breaks, but we'll just hopefully have time at the end. So, as a reminder, make sure that you have, hopefully, you've begun to go back and review the recordings from week one, the nursing process, what it includes, delegation. Hopefully, just take the time to go back and review those classroom recordings and also those exam review recordings. You should have received information from your campus regarding your HESI by now. Remember, it is campus specific. If you have not, please send an email to your campus dean because they are the ones that coordinates that. And usually HESIs are taken in week 11. For those of you that have more than one class, remember we talked about that in week one and several times since then. Just think about what that's going to look like. Usually you don't take your HESI this time of night. So that next week is going to look different. And if there's some issues or concerns, please have those conversations before the day of, because you want to do your best. The HESI counts as, I believe, 20% of that KGA. So that's a huge percentage. It is very important that you do your very best on that exam as well. All right. So let's go ahead and just talk about some of the concepts that nursing process is a huge piece. So just think about each piece of that nursing process. And I have a PowerPoint I'm going to share here too. But the nursing process, the analysis part, we are gathering that information. Remember your subjective, your objective information. We're gathering, we're data collectors. We're going out, getting all the information that we need because where we're going, we're trying to create this plan for this patient, this roadmap that tells us how to take care of this patient. So how we're going to create an accurate roadmap in taking care of this patient if we don't know what's really going on with them. So remember subjective, objective data. Subjective data is the information that we get from the client, the patient, the resident, depending on what setting they're in is what you call them. And then the objective information is what we gather using 4 of our 5 senses. When we don't taste anything, but think about those blood pressures, that boom, boom. We're listening to the sound. We see where the dial is on the blood pressure monitor. We're getting information from the chart. It's chart obtained objective information. So think about all of that information, subjective, objective. So once we collect all of this information, we do want to, of course, verify the information that we receive that it is correct. And then we collaborate with the registered nurse, remember, to come up with the next steps. We're planning. We develop, the plan for the client. And then we do implementation phase. This is where we're actually reinforcing teaching. We might be administering medication. We're doing something, the implementation phase. And then that last phase, that evaluation phase, is where we're comparing the client's responses with the outcomes to see if we need to change up anything, whether or not the goal was met. If the goal wasn't met, do we need a new intervention? Do we need to go back and collect more information? So the nursing process, just think about, break it down, talk yourself through it. What is happening during each of those phases. Let me just make sure we're recording. Yes, we're recording. Nursing process. So clinical judgment measures, recognizing the clues, making sure that you're reading through what the scenario actually is saying. If it's asking you if this client needs further teaching, that means that something that they're saying or doing is not correct. Because remember, a person does not need further teaching if what they're saying is correct and what they're actually doing is correct. So look at those clues. We want to, we're generating solutions. What things should we do? What action should we be taking to help to resolve whatever the issue is? And we just talked about this, the nursing process. We're going to evaluate our outcomes. Did this medication we gave, if the person had a fever, did the antipyretic that we gave, did it help? Well, we checked the temperature and it's still the same. The temperature went up or the temperature went down. Do we need to go back and come up with another intervention? So I always think about safety, no matter what the situation is, be thinking about safety. Remember, most of the time the clients are not at home. They're in the hospital setting. They may be in a long-term care facility. And even if they are at home, what are those things that's putting them at risk for some harm coming to them? Falls is a biggie. So what are those things that we can do so that this patient remains safe and does not sustain any injuries? Lighting, our pathways, are they clear? Are things crowded? And then, of course, coordinating care. Remember, it's more than just us on that healthcare team. We're usually like leading the team, but we work along with the respiratory therapist. We may have to make that phone call to say, hey, we have an order for, for this medication or for this procedure to be done. We may have to call physical therapy and let them know that they have an order, a new case. But this coordinated care, we all work together, all those moving parts to take care of that client. Safety and infection, want to make sure that we're thinking about, washing hands, thinking about those precautions. And of course, we're always promoting doing health promotion. Think about the different levels of care that we're going to provide. If this person has a disease process or injury, are we trying to help them manage it? That's tertiary. So think about the different levels of interventions that we are providing for that client. But we want to keep them safe and we want to decrease the risk of anything, any exacerbations, anything else further happening to them. So nursing concepts, again, it's still pretty much the same thing. Being professional, go back to those different communication styles, assertive, being aggressive, think about that. And you probably will be presenting some different scenarios. And, they want you to identify, is this an assertive scenario? Is this an aggressive scenario? But we want to perform and act and condone ourselves in a professional manner. So, of course, we want to be assertive, telling things that are true. We want to be truthful, give it information, in a nice, truthful manner. We do want to establish those therapeutic relationships with our clients. So in the event that something does go wrong, then the blow is not as hard because you've established that relationship. They do understand that we are humans, even though we're there to help them out, but it kind of softens the blow. So make sure that we're communicating correctly. Go back to those delegations. Ensure that what is being communicated is actually what was received. Remember that video we had, I think it was in week 2, I think, where and there was a conversation and the information that was sent out was not the information that the receiver actually received. So making sure that the information that we're selecting is clear and succinct. Remember that those one words, but all, ineffective versus effective, those 2-3 letters can change the whole meaning of what is being communicated. So make sure that you're taking the time to read through and ensure the correct information is being communicated. Remember, we reinforce. Think about those words, reinforce versus initial. Safety is a biggie on these are just some topics: safe, effective care, management of care, legal and ethical. Think about the things that we just said that puts the patient at risk for something adversely or wrong or for something happening to them that's bad. Making sure that call light is in reach, that bed is in the lowest position, pathways are clear, good lighting. And then remember that we reinforce and we want to do what's in what our Nurse Practice Act says it is lawful for us to do. That guides us. Remember, the facilities, policies, and procedures, they should mirror what the Nurse State Practice Act says that we can lawfully do. So that keeps us being practicing ethically and legally. Kind of talked about this, know about your different precautions, infection control, making sure that information that we are sharing is that we have permission, because people's health information is private. Even if you have a coworker, the your coworker had the patient in the emergency room. Now the patient is on ICU or med surge. Well, that nurse that took care of the patient in the emergency room is not required to provide any care for that patient. So be careful with providing information. If the person, the healthcare provider, if they're not providing care for them, then we don't share that information. As a matter of fact, with the electronic health records, once that patient is transferred, you can't actually go in and just click. They got it kind of a safe wall up. It's not a firewall. I forget what they call it. And that just helps us to not, breach confidentiality. Family members, they want to know, well, how's my loved one today? Well, if we don't have permission to talk to them, you can encourage them to go speak to the patient, and or ask the patient to put their name down so that we can give them information. Otherwise, we cannot give information out. Medication administration, remember your rights of medication administration. That client has the right to refuse. Make sure you have the correct dose, the correct medication. Remember those rights of medication administration. We want to take the time to do that so that we can administer that medication safely. Remember, that's one of those national patient safety goals. Administer medication safely. We do want to include our client preferences, because remember, it's their care. The care is being provided to them, for them. And so we do want to preserve the practices and that are safe. Now, if they have a practice that's not safe for them, we want to offer those alternatives. We want to repattern those harmful preferences that they might have. But we do want to be culturally competent and include their preferences. We want to first of all identify, what do they know about the disease process or the procedure or the medication that we're providing for them. Priority is going to be a big on the exam. We've heard that it is. We don't know. We haven't seen the exam, but they usually say that it is. So just think about priority. ABCs. Think about Maslow's hierarchy of needs. What's that foundational level? ABCs: airway, breathing, circulation, and shelter, food. Is this client stable versus unstable? How much care does this client need? Are they set up, or do they need one person, or do they need two persons assistance for the care to be provided? So think through, priority. Okay. Any questions so far? So rights. I think we have a slide on here. We've had one before about delegation. Remember about those rights of delegation. If all those components are not met, then we have not delegated appropriately. Can't get away from this communication. Making sure the information is correct that we're communicating. Management of care. Clients, they do have the right to refuse, but we do want to make sure that they have enough information to make an informed decision. And we do support their right to refuse. Okay. Proper equipment, blood pressure cuff. Just making not only just the blood pressure cuff, but all of the proper equipment. If a patient, they need a bedside commode, whatever it is, just making sure that we have it. This client gets ready to be discharged, we may have to talk to that home health, not home health, but the equipment, medical equipment facility. We only give them the information that they need, but we do want to make sure they have all the equipment so that they can be able to manage their care at home. Talked about the Nurse Practice Act. These are the things that we can lawfully do. That's our to-do list. And usually the facilities, policies, and procedures, they should match. what the Nurse Practice Act says. And so, and it's going to vary, depending on your setting. So some things that you do in acute care setting at a hospital, you might not do them with home health. But nevertheless, those policies and procedures should match this Nurse Practice Act. And you have to, if you're in one state, but you're multi-licensed, you must follow that Nurse Practice Act for the state that you're actually in. Okay. Remember, we have the never events and the sentinel events. Both are something adversely or not so good happening to our clients. But one of them is where there is usually a loss of life, a loss of a limb, but these things are usually preventable if we just take the time to do the procedures that are in place. What most people have is a universal thing where we have timeout. For example, if a person is getting ready to have surgery, some type of procedure, everyone stop where they're doing, they verify that they have the correct patient, the correct extremity, the correct procedure, just so that we, do things correctly. Because we don't want someone going in and they're supposed to have a right great toe amputated, and we end up amputating the left toe, but then we still have the right great toe that needs to also still be amputated. So things like that happen, but we hope that it doesn't. So we want to encourage people to, just follow those policies and procedures that are in place. Just take the time. Let's see, legal and ethical. Nurse practice within your scope of practice, which comes directly from the Nurse State Practice Act. We do have some practice questions coming up here pretty quickly. So strategies for being successful on the nursing test. Let's see. Let's see what we got here. But I'm going to read this slide in its entirety. Let me go back. Okay, so you want to identify the question type. What is this question about? Put that question into context. Are we talking about this client needs further teaching? So that means that they are saying something that's incorrect. Is this question asking me to select something that's priority? Remember, with that, you probably can do several or not, if not all the answer choices. But if it's asking you priority, it wants you to decide which one should be done first, the most, which is most important. So, and then assess versus implement. Are they wanting us to assess something or actually do something, implement? And then we talked about Maslow. Think about that bottom layer, which is foundational, physiological, food, water, shelter, airway, breathing, circulation. That helps you to put things into priority. And then we have spec. So is the client stable or is this client unstable? Potential versus real, is what is in the scenario, is this a potential problem or is this a real problem? Potential, an example could be the client has poor nutrition, they require total assistance, they don't turn and reposition themselves. So the potential is there for skin breakdown. A real problem is this client actually has a stage 1 or 2 or 3 on their coccyx. That's a real problem, that there's actually an opening in the skin. So that's the difference. Expected versus unexpected. So go back to your disease processes. Go back to those body systems. If someone has hypertension, which body system is mostly affected? Of course, cardio. So what do we expect someone to, what their blood pressure readings, what do we expect those readings to be if they have hypertension, especially if it's not controlled? Well, it's going to be over that 100, that 120 over 80. And so we would have to, provide that correction. But if someone has hypertension and an outcome is their left great toe is hurting, that's not expected. That doesn't match with that disease process. So read the question, identify what is happening in the situation. What is the concept or the topic? Is this an expected outcome of this disease process or this is unexpected? And then chronic versus acute. Acute is something that's new, that's just happening. Chronic is something that's been going on for a while. And we talked about the ABCs already: airway, breathing, and circulation. And then expected outcomes. We talked about that as well. Okay. Some other strategies that you can use. You can imagine or visualize that client or that situation as you're reading through the question. Okay. Go back to the labs that you've learned. Is this a normal value or this an abnormal value? What are the normal heart rates? What is the normal respiratory rate? Okay. And then put things into context. Is this a new admission or has this patient been here for several days? Is this client immediate post-op or is this post-op day 5? Because we do things just a little bit different depending on the time frame, the time. Okay. Consider who you're teaching. Consider who you're taking care of. Is this an adult or is this a child? Because what we're gonna teach and who we're going to be talking to is going to be different if this person is under 18. Okay. First doesn't always mean assessment. Actions don't always mean implement. Okay. So it could be just reinforcing rather than actually administering the medication. So it could be that conversation that we're having. We talked about Maslow's hierarchy of needs. Know the different levels. And know that the unmet needs will create tension. So it'll create that person and try to come up with a solution. So if I have problems breathing, or if I don't have food, water, or shelter, then I'm going to try to resolve or get some type of solution to those problems before I worry about the other things that are on the triangle. Even though it is our bottom level, it is of highest priority. Airway, breathing, circulation, food, water, shelter, that's the highest priority, even though it's on the bottom of the triangle. Physical needs take priority over psychosocial needs. So if I'm hungry, if storm just came through, I don't have anywhere to live, that's going to be priority over all these other things. This is just another way of thinking about it. We talked about ABCs, safety, pain, like put it in this order to help you pick out what is priority. We talked about airway, breathing, circulation. I always think about safety. And you can ask yourself if you have a scenario and they have you to select a patient of which one is priority or which one should be taken care of first. Remember, we're going to take care of everyone, but the question is, who are we going to take care of first? And you can ask yourself, well, who's going to probably die first? That's going to be someone that has problem with airway, breathing, and circulation, and that's going to be your priority patient. But you're going to come back and take care of the others, but you got to take care of the ones that's having problem with that gas exchange. If they're bleeding out, if they're having an asthma attack. And again, safety. Got to think about safety. This slide is similar to what we just went over. To prove minimum competencies, a beginning nurse must demonstrate the ability to make appropriate nursing judgments. So what does that mean? We need to be able to recognize both expected and unexpected. You have a client that has a certain condition, diabetes. What are some expected labs or some expected procedures, for this disease process to help manage it? Well, some expected labs is more than likely this person's going to have a glucose, going to have a hemoglobin A1C. So that's what they mean by expected and unexpected. Think about the disease process. Which body systems does it mostly affect? Which organs are not functioning like they're supposed to? And as a result of that, that equals that disease process. Outcomes allow the nurse to evaluate whether goals have been met. What is the expected outcome of your action? We gave the medication for fever. And so we expect when we go back to check the temperature, we expect the temperature had to have dropped back to normal or at least decreased some way. What is the best action for the expected outcome? Will it help or hurt the situation? Is it okay to go ahead and we check the temperature at 2 hours, but we know that the Tylenol is not supposed to be given to 4 hours. So that will hurt the situation. Of course, we are violating all kind of medication administration rights. So we don't do that. We just recheck, but we can always call the healthcare provider. And you can ask yourself, is this a desired result? We're giving the Tylenol or whatever the antipyretic is, checking the temperature, and it's going down. Is this desired result? Yes, we want that temperature to return back to normal. Okay. If I can only do one thing, then leave the room. What would that thing be? That helps you decide on what should be priority. These are just some different ways of trying to come up with what is priority. You may choose some of those techniques and you might not, but just whatever helps you to think through, put things into categories and decide. And that's up to you which technique you use. Okay, so we have a few questions here, challenge questions. And you can come off mute and just tell me 1, 2, 3, or 4. Which client's complaint of pain should the nurse respond to first? So go back to what's expected, what's unexpected, airway, breathing, circulation. Consider all of that. And remember, we're going to take care of all the clients, but it's asking you which one are we going to take care or respond to first. Okay. All right. So bladder pain while receiving a continuous saline irrigant 2 hours after the transurethral prosthetic resection, after the TURP. So bladder pain, that's unexpected. So we're going to take care of that person first. So let's look at the other 3 situations. Bladder spasms after draining 1,000 cc's of urine during insertion. So they insert the catheter and it's draining 1,000. That's a lot of urine. So of course that bladder is going to be spasming because it's emptying so quickly. That's expected. We have flank pain that is partially relieved after passing the renal calculus. Remember, those little things are painful. So they're going to have that pain there. That's expected. Incisional pain on the 3rd day post nephrectomy. The person is requesting a medication for pain. That's expected. Okay. So let's look at another one. The practical nurse is evaluating a new client's risk for osteoporosis who has recently moved into an assisted living community. Which task should the PN assign, talking about delegation, delegate to the unlicensed personnel? Take weekly heights and weights, review medical records for disease history and compare the findings, perform full range of motion on all extremities, inspect and palpate the client's vertebral column from neck to hip. So if it requires judgment, and if it's a skill, then we're not delegating those things. Okay. Okay. Got it. So it's asking us which task should we? So we want to select something that is appropriate. You're right. Checking that height and weight. But if we were to say, measure the height and weight and determine whether or not they've lost weight, then we would not have selected that one because that's requiring judgment. But it just say, hey, simply measuring the height and weight. Great. Good. Okay. So active listening. I know you all remember these. And silence is the one I think that we have the most issues with. Is just remaining silent. That is therapeutic. It is okay just to let the person know that you are there. If they're not ready to move forward with making decisions or discussing whatever, you just be present and remain silent. Restating, clarifying, reflecting, we're rearranging what was said so that we can ensure the information that was sent to us from the sender that we received is actually correct. And if we're wanting more information from the client, we do that minimum encouraging. We may motion our hand, or we may motion our head, or we may make sounds like go on, things like that. But restating, clarifying, reflecting, paraphrasing, validating, summarizing. We are changing the words up, or we're conversating with our person to just ensure what they are saying, that we did receive the correct information. Okay. Negative. The one that we get caught up with is giving advice, because they're going to always ask you, because you're the nurse, they trust you. You're the most trusted profession. Well, nurse, what would you do? But remember, it's considered negative if we give advice. We always want to make sure the client has enough information so they can make an informed decision, but it's up to them. So we give it back to them. Hey, it's ultimately up to you. It's whatever you decide. We don't say everything is going to be okay. That's false reassuring. We don't make assumptions because, clothes are on the couch, dishes are in the sink, or a person is coming in and they look a certain way and they're having a certain procedure done. We don't want to belittle anyone. So I am going to stop sharing here. I'm going to be good to ensure that, you are signed up for the HESI and you know where to be, the time, and on what date. Because sometimes your HESIs are not the dates, the day of the week that you actually have class. All right. Okay, we have another challenge question. The practical nurse is observing an unlicensed assisted personnel provide care for a client in an assisted living community. Which action by the unlicensed personnel should the PN determine is safe for the unlicensed personnel to continue? So this means that the unlicensed personnel is doing something that is correct, that they are supposed to do, that they can do lawfully. Okay. Number one says accept verbal prescriptions from the healthcare provider. This is accepting an order. Verbal prescription, same thing as an order, verbal order. Obtains vital signs for a client who takes blood pressure medication. Assesses the stage 2 ulcer on the coccyx for signs of improvement. The last one says gives an initial dose of antibiotics. So the unlicensed personnel can take those vital signs for someone that's on blood pressure medication. It didn't say that this client was being administered that the unlicensed personnel was going to administer the blood pressure medications. It is just saying that they are taking the vital signs. They're measuring the heart rate, they're measuring the blood pressure, respiratory rate, O2 saturation. And this option does not say that the unlicensed personnel is deciding whether or not their vital signs have worsened or improved, because remember, we do not assign anything that requires them to complete a skill. A skill would be administering this medication, and we don't require them to do anything that requires judgment. Assessing the stage 2 ulcer, and that means that unlicensed personnel would be measuring it, looking at it, changing the dressing out. That's not something that they should be doing. Okay. The practical nurse is emptying a client's urinary bedside drainage unit. Which component of the nursing process is the PN using? Okay. They're doing the implementation. We're performing a procedure. Implementation. Good. Remember, we're going to see all of our patients, but this question is asking you, who should we see first? It's asking you for priority. Now think about what's expected, what's unexpected. Think about airway, breathing, circulation. That helps you to narrow it down. Who should we see first? Okay. Now I'm going to let you look at the clients. Okay. This temperature, this is not expected. This is an emergency. Okay. So a person that has Crohn's, think about what the disease process is. They do have watery stools. That's expected. Someone that has liver failure because the liver is not performing or doing the task that it should be doing, then the person ends up being jaundice, has that yellow tinge to them. That's expected. Bowel obstruction. The bowel is obstructed. So the bowel has to come out another way. So that person throws up. That's expected. So here it is. This person has 102.7 fever. This is emergency. So we're going to see that client first. Who is or are the most common reasons that a new grad loses his or her license? So we want to ensure that when we get information, for example, if the lab calls us and say, hey, I'm calling about the client that's in room 201. They have a hemoglobin A1C of, they have a white blood count of, they're giving you results. They're calling the chest x-ray results. We receive that information, but we do not notify the healthcare provider. That is failure to notice and recognize. Okay. So that's being negligent. So if you're receiving this information, ensure that you're reporting it to the healthcare provider. If we have changes in our client, remember we do those changes shift reports. That's establishing our baseline. So once we get there, we compare our head to toe assessment findings with what the nurse that left told us. If we see that there's a change in this client's condition, we must report that. We don't want it to be that we fail to report a change or decline in a client's condition. Okay. That is being negligent. And that can lead to that client losing their life. It can lead to that harm being caused to that client. And so as a result of that, if their duty is breached and that client has some type of harm and they can prove the proximate cause is related to us failing to do something, failing to communicate, then we're at risk for losing our license and fines and jail time and all of that. Okay, let's look at these principles of ethics. Non-malfeasance, to do no harm. Beneficence, is this what I'm going to do for this client? Is it going to benefit this client? Autonomy, the client has the right to choose. Auto, self. Okay. Role of privacy and autonomy. Privacy is both a legal and ethical issue. Fidelity, be true, and then justice for all, no matter what. We're there to provide the best care for that client, no matter what their pay status is, no matter if they're non-compliant, they're a return patient. We are to treat them fair. Okay. Negligence. Was this client assigned to us? Was it our duty to provide the best care we can for this client? Breach of duty, meaning that something on that care plan, remember that's our roadmap to tell us what to do for this client. If it says on the care plan that this client needs 2 persons assistance, 1 person assistance, and those things are not provided, and that client ends up hurting themselves or have some type of damage, and they can prove that the damages was a exact relation to us not performing the duty that we were supposed to, meaning as a breach of duty, then we are deemed negligent. So those 4 elements: duty. Is this client assigned to me? What does the care plan say that I'm supposed to do for this client? Did I do what the care plan said to do? There's sometimes a client will have bad outcomes and they have damages, but it is not because sometimes it's not because the person, the healthcare provider, the nurse did not do what they were supposed to do. But in the event that one of these 4 elements are violated or proved, that means that person was negligent in providing the best care for that client. Okay, got another case study. I'm gonna let you read through it and then I'll talk you through it. Okay. Mrs. Stone is recovering from pneumonia and has been receiving steroid and antibiotic therapy. She has an indwelling urinary catheter that was placed 4 days ago. Then, although being afebrile for 24 hours this morning, her temperature is 99.9. Okay, those are your concerns. Delegation to a nursing assistant, ambulation, vital signs bathing, emptying the Foley catheter bag, repositioning, assisting with feeding. These are tasks that can be delegated. Do not delegate anything that's going to require communication to a physician, providing education, medication administration, performing any procedures, dressing changes, inserting a Foley catheter, administering medication, and assessing, listening to lung sounds, bowel sounds. We do not delegate those things. Okay, let's go back. What are some areas of education that LPN should reinforce with Mrs. Stone concerning pneumonia? Okay, we are reinforcing. Remember, pneumonia has mostly to do with the lungs. That's the organ. What's the body system? It is a respiratory system. What does our respiratory system do for us? It allows us to inhale oxygen and expel that carbon dioxide, that gas exchange. So the lungs cannot function, inflate and deflate like they're supposed to. What happens? You have this fluid that sets up, and then it ends up having bacteria. So that person ends up with pneumonia. So what are some things that what's some information that we can provide for this patient so that they can get better? We can encourage them to cough and deep breathe, take frequent rest breaks, use that incentive spirometer, kind of force those lungs to inflate and deflate. Virus transmission, we want to use those precautions. Take all medications as prescribed, even if they're feeling better. And they need to still take the medication as prescribed. And as always, drink plenty of fluids. Drink plenty of fluids. So these are our rights of delegation. When we are considering whether or not we should delegate this task to an unlicensed personnel, let's make sure that we have these 5 rights. Is it the correct task or duty for this unlicensed personnel? Are we getting ready to ask this unlicensed personnel to administer medication? No. Are we getting ready to ask this unlicensed personnel to measure this person's blood pressure? That's okay. Is it the correct task or duty? Is it within their scope? Is it the right circumstance? Is this client stable versus unstable? Is this the correct patient? Is it the patient that's in room 201? Is it bed A or bed B? Is this the correct person? And then be sure that we communicate the correct directions and instructions. We need you to measure this person's vital signs every hour. That includes blood pressure, pulse, respirations, oxygen saturation. And then, of course, the correct supervision and evaluation. Okay, I'm gonna we'll need a little time to read through this. It says, which of these assessment findings indicate a positive expected response in a 35-year-old client recovering from pneumonia? So it says positive expected. Okay. So we're not going to select anything that's negative. Okay. So we're looking for things that indicate this client is getting better because it says positive expected. Right. So look at the first one. Temperature changes from 98.4 to 99.8. This is a positive change. The heart rate changes from 102 to 110. What's the norm? 60 to 100. Okay, is this heart rate getting better or worse? Positive or negative? The O2 saturation is going from 92% to 95%. Is this getting better? Is this a positive or expected? because it says this client is recovering. Okay. Urine output goes from 42 cc's to 110. The client is disoriented to time. What's the norm? The norm is we are oriented. Okay. Crackles decrease. JVD increases. Jugular vein distension. If it's increasing, is that good or bad? Positive or negative? Okay. So this is how you should be talking yourself through each of these little scenarios. And then sometimes you have to go back and look at the main question. It says this client is recovering. So the client should be getting better. And we talk, and it tells us to identify positive expected results. Okay. Here we go. All right. Good. So the O2 stat is improving. Remember, we want it to be 95 to 100% anyways. The crackles are decreasing. Now, that would have said crackles increase, and we wouldn't have selected that. But it says crackles, the abnormal lung sounds, they're decreasing. So those lung sounds are getting better. So what that means is that infection is getting out of those lungs from that pneumonia. And then the potassium level is going back towards the norm. The creatinine level is as well. Because initially both of these levels are high, but it's getting back to the norm. So these are expected positive changes from a client that is recovering. Okay, here we go. A client has been taking antibiotics for 3 days to treat polyonephritis. Which finding requires the nurse immediate attention? So that means, is it something immediate? That means something's pretty bad. Which one of these is pretty bad and we need to immediately do something? Okay. The fever. Exactly. We have to respond immediately to that fever. That's the body's way of telling us, hey, we need to do something fast. Okay. Go back to expected or unexpected. This client's been taking antibiotics for 3 days. You know, that fever, that person shouldn't have that fever. That's not an expected outcome. This person has pyelonephritis, so yes, they may have the cloudy urine. And we do know taking an antibiotic sometimes will make people have a decreased appetite and they may feel nauseous. So those are expected, but that fever is not expected. Day 3 on antibiotics, that client should be getting better. Okay, let's look at this one. So if the client is questioning, it says the nurse would question what part of the teaching plan. That means something's probably not correct. If we're questioning something, okay? Avoiding large crowds, fresh fruits and vegetables, okay? Activity restrictions and protective isolation are not indicated for someone that's taking this medication. Okay. Here we go again. An LPN is assigned to perform assessments on 2 patients with diabetes. Assessments reveals all of these findings. Which finding would the RN instruct the LPN to report immediately? So this is something that is gone wrong because it's something we report immediately. So this is a bad outcome. Finger stick reading of 185, numbness and tingling of both feet, profuse perspiration, bunion on the left great toe. So let's go back to the question. We got these 2 clients. They have diabetes. Think about that disease process. Which body system? Mostly the endocrine system. What organ is not functioning or organs are not functioning like they're supposed to? Okay. But then it's saying immediately. So that's something's going wrong that needs our attention. Airway, breathing, and circulation. Which one of these answer choices? Airway, breathing, and circulation. Profuse perspiration is a symptom of hypoglycemia, a complication of diabetes that requires urgent treatment. That client mental status change, if they're profusely perspiring, more than likely that sugar, that glucose has dropped. And that does require our immediate attention. Okay. The rest of those are not urgent because it says immediately. The rest of those findings are not urgent concern. Okay, delegation. Let's think about our rights of delegation. Let you read through this. Okay, delegation. Which activities will the LPN delegate to the unlicensed person? It says select all that apply. So which of these is okay for the unlicensed personnel to do? Okay. If it's a skill, medication administration, certain Foley catheter, wound care, it is something that requires judgment. Remember, these are things that they're not going to do. So it says, which activity will the LPN delegate? So which of these is okay to delegate? Measuring that pulse. Recording means writing down what the pulse is and writing down what the blood pressure measurement was. Reminding the client to allow adequate time for meals. Assisting the client with prescribed strengthening exercises. Okay. Evaluating the client's response to medications is not within the scope of an unlicensed personnel. Unlicensed personnel education and scope of practice includes checking pulse, blood pressure measurements. The LPN would be sure to instruct the unlicensed personnel to report heart rate and blood pressure findings. In addition, the unlicensed personnel can reinforce previous teaching skills taught by the RN or personnel in other disciplines such as speech or physical therapy. So what they'll do is speech and physical therapy, they'll come up with these plans. And so the example here is the unlicensed personnel can remind the client, hey, slow down what you're eating, take your time, make sure you chewing up all your food. Just take your time and eat. Don't rush through your meal. That's what those plans will look like that comes from speech or physical therapy. And they can do that. Okay. Here we go. An assignment question. A 23-year-old client with a recent history of encephalitis is admitted to the medical unit with new onset generalized tonic-clonic seizures. Which nursing activities included in the client's care will be best to assign to the LPN whom the nurse is supervising? Okay, let you read through these. Okay, observing and documenting the onset of duration of any seizure activity, administering that phentonin, dilantin, and turn the client on his or her side to avoid aspiration. Any nursing staff member who is involved in caring for a client should observe for the onset of the duration of those seizures. A more detailed assessment of seizure activity should be done by the RN. Administration of the medications is included in the LPN education and scope of practice. Turning that client on his or her side to avoid aspiration is certainly within the scope of the practice of the LPN. Teaching, discharge planning, and assessment for adverse effects of new medications are activities that require the RN scope of practice. Okay. We have a 23-year-old with a recent history of encephalitis. Oh, this is one we just did. Okay. The nurse is working with an experienced, unlicensed assistive personnel and an LPN on the telemetry unit. A client who had an acute myocardial infarction 3 days ago has been reporting fatigue and chest discomfort when ambulating. Which nursing activity included in the care plan is best assigned to the LPN? Okay. Administration of nitroglycerin and appropriate client monitoring for therapeutic and adverse effects are included in the LPN education scope of practice. Collection of blood pressure, pulse, and oxygen saturation, those things can be delegated to the unlicensed personnel. Client teaching requires RN level education and scope of practice. Because it did not say reinforce, it said teaching. Okay. Critical thinking. A client whose systolic blood pressure is always higher than 140 millimillers of mercury in the client tells the LPN, my blood pressure at home is always fine. What action should the nurse take next? Okay. The American Heart Association recommends home blood pressure monitoring for clients with hypertension or hypertension risk factors because home blood pressure monitoring provides more accurate data about usual blood pressures than that periodic monitoring. So them coming into the office at one time is not as accurate as this client checking their blood pressure at home several times while they're there. The other actions may be necessary, but further assessment of the client's usual blood pressure is needed. We need to know because there is a such thing as that white coat syndrome. Some people do have where when they come into the doctor's office, that blood pressure is going to be high. But under other circumstances, that blood pressure is always normal, but we don't know. So we would need to do further assessment. So we'll have that client to monitor their blood pressures at home, doing home blood pressure monitoring. And they can, write that information down and bring it in so we can get a clearer picture of what's really going on with this person's blood pressure. For a patient with hyperthyroidism, which task should the nurse delegate to an experienced UAP? So it is asking you to delegate a task. Which task can the UAP safely do? Go back to your rights of delegation. Remember, we're not going to ask them to complete any tasks that we should be doing. Okay. Monitoring vital signs and recording their values are within the education and scope of practice of the UAP. Instructing and teaching patients and performing venipunctures, that's drawing blood, are more suited education, and that's for the nurse to do. Remember, as LPNs, we reinforce teaching. The RNs are drawing blood. And instructing is the same thing as teaching. So don't get mixed up on those, tripped up on those words. If a person is instructing, that they are also teaching. So remember that unlicensed personnel should not be teaching. They should not be instructing. So think about what the word is, what the meaning of the word is. Okay. In addition, remember, go back through your classroom recordings from week 1. Be sure to review all of the HESI reviews that are provided for you in your announcement section. There's Dr. Tenza, myself, and Professor Martinez. Reach out to your campus deans to ensure that you have registered and you're ready, you know, the date and time that your HESI will occur. And it's campus specific. So you must reach out to your campus dean to see when your test will take place. Happy learning.